Hi, my name is Nirvana and I'll be talking to you about some causative factors and improvement strategies for the inequality in access to healthcare for this rural and remote community. Importance of access to healthcare services. You as a community should be concerned about the inequality in access to healthcare because it impacts the overall physical, social and mental health status, prevention of disease and disability, detection and treatment of health conditions, quality of life, preventable deaths and life expectancy. You have a right to equal access in healthcare services. This is supported by Article 25 of the Universal Declaration of Human Rights, as it states. Everyone has the right to a standard of living adequate for the health and well-being of himself and his family, including food, clothing, housing, medical care, and necessary social services. Causative factors. What causes inequality in access to healthcare services? Localism. You and your family can move to a more urban and local region. However, many of you will not want to relocate because you are attached to your community. Long distance, poor roads, and lack of transport also causes inequality in access to healthcare services. This is due to the dispersed nature of the population. Because of these factors, you have to depend on private and community transport providers, and this can be expensive. Lack of funding leads to many things such as lack of education within the community. Nurse Paul Button says, a lot of people in Central Australia, including Kintor, have been left behind in comparison to metropolitan areas. Kintor is very remote, and the environment issues create illnesses. Paul says children from birth to 7 years of age do not get runny noses. This is because children are always in the dust, and as a natural response to dust, the nose produces nasal secretion. A lot of secretion allows the germ to spread, leading to infections. If they were educated about health, they can prevent themselves from getting ill. Insufficient funding also causes lack in infrastructure, including inadequate resources, faculties, services, and technology. This also inhibits resources to move across different health programs. Additionally, lack of funding leads to shortage of health professionals.
One of the most serious challenges that we face in rural and remote health is how we're going to get a good number of and well-supported and well-trained workforce, health workforce in country areas. We're short of doctors. We're short of nurses, we're short of dentists, we're short of pharmacists, we're short of physiotherapists, podiatrists, occupational therapists. One could go on.
Lack of interprofessional communication and collaboration will lead to less efficient healthcare delivery, reduced patient satisfaction, increased uncertainty, and poor pain management. A case study was conducted in 2007 about interprofessional rural clinical practice. It said that in Australia, some radiographic examinations were performed by rural and remote nurses and general practitioners when radiographers were unavailable, and they called themselves remote X-ray operators. Most remote operators provide a valuable service, but the quality of their radiography is below expected standards. Better interprofessional collaboration would improve service quality and lead to a more equality in access to healthcare. That was just one of the reasons why interprofessional communication and collaboration is important. Roles and responsibilities are fragmented in your community, and divided responsibility limit the extent of integrated approach to access to healthcare services. These are just some of the factors that cause a health gap between urban and local areas and rural and remote areas in Australia. Improvement strategies. One strategy cannot fit all rural and remote areas. Some strategies include funding of rural and remote health services, increasing transportation, increasing workforce, increasing infrastructure, e-health. I will be discussing increasing infrastructure and e-health. Infrastructure is required to support a medical and health workforce. An example of a program is National Rural and Remote Health Infrastructure Program. They improve access to healthcare services by funding rural and remote areas, enhancing existing primary healthcare and medical faculties, improve resources and faculties available to private general practitioners and health professionals, assist to develop flexible long-term solutions for the health services to meet the needs of the community, improves the ability to recruit and retrain the health services. E-health. This is an online community for health and medical professionals who are interested to improve access to healthcare for patients. The benefits of e-health include the ability to exchange health advice and teach over long distances, and this also reduces expensive transport needs. It enhances the clinical-patient relationship so it's not fragmented, leads to a successful interprofessional communication and collaboration, enhances healthcare by allowing you and your doctors, hospitals and other healthcare providers to view and share your health information to provide you with the best possible care. Some examples of e-health organizations include Personally Controlled Electric Health Record, Telehealth, National E-Health Transition Authority. Obstacles for e-health include the acceptance of new technology and the availability of internet access. If these issues are addressed, eHealth can assist your community and gain equality to access of healthcare services.
Janet Rutledge goes through a series of medical tests without ever leaving home. She's one of a growing number of people using remote technology to interface with medical professionals miles away. It's called telehealth, and Janet uses it to monitor congestive heart failure. Janet credits her virtual setup for keeping her happy, healthy, and home.
I feel great now compared to what I have in the past.